And I'm Vice President of Digital Health Strategy and Innovation at the American Medical Association. And really, at the highest level, what we're focused on is how do we help to make technology and new innovative solutions an asset versus one more thing or one more burden on the plates of physicians and really ultimately patients and other members of the care team. So to do that, we're really focused on a lot of initiatives that relate to research and national research for digital health, and I can speak to that a bit, as well as how do we help to scale the adoption of evidence-based and trusted solutions in market. So think things like, of course, virtual care and telehealth at this point, remote patient monitoring solutions, and then you've got the really entrance of a lot of emerging tech, like, of course, AI, which is the hottest buzzword of the moment, as well as digital therapeutics and other things.
No, wonderful. And the title for this specific talk is all about the sustainability of the adoption of digital health. Often we talk about just the technical side of stuff. So it'd be really useful to hear from you about now going into a post-pandemic sort of reality where we're getting over COVID. Where are you at the moment with the AMA seeing like those examples of the implemented technologies, like that are equating to those improved and equitable outcomes, like remote patient monitoring?
Sure.
And what kind of sustainability is, what's needed for that kind of sustainability?
Yeah, of course. So just as a bit of context, I joined the digital health group in 2016. And when I joined, we started off by doing some baseline digital health research to really give us a pulse check on what were physicians in 2016 using then in practice. And this was taking into account that everyone was already using electronic health records, of course, but really as it relates to remote patient monitoring, e-visits, telehealth, clinical decision support tools, et cetera, what were physicians using in practice? What were they excited about using or enthusiastic about using? And then what those key requirements for adoption were in terms of what nuts and bolts need to be there. And at the highest level, one, we were glad to see, despite frustrations with the EHR, that there was enthusiasm to want to adopt technologies and new solutions. But that enthusiasm was directly tied to a solution's ability to help them take better care of patients or ultimately save them a minute of time and help them actually see face-to-face, be it virtually or not, their patient in an optimized way. And their key requirements we really heard loud and clear, and those were really around, prove to me that there is an evidence base here and that I can trust this if I use it. Prove to me that there's a fair payment pathway or reimbursement pathway if I'm going to use this or prescribe it. Prove to me that there's liability coverage or who is going to be liable, right, if something goes wrong, especially from a data privacy and security standpoint. They really need a confidence in that. And then lastly, and often the most difficult, is just the change management of introducing one more thing into a workflow. So that adoption piece and really the red tape at times of integrating one new technology or solution into practice is where we spend a lot of time, and we also have a lot of free resources that I would hope that anyone in the audience would go on and use today. These are a range of different implementation playbooks. We have one on remote patient monitoring, another on telehealth, and then we have another on health at home and emerging health at home models that will be released very soon. And these really soup to nuts go from what problem are you looking to solve to based on qualitative and quantitative feedback that we've seen, as well as really best practices that have been collected from practices of all different sizes, really large health systems and small private practices. What's worked well and what hasn't worked well as it relates to adoption, implementation, and ultimately now moving into a post-pandemic environment, what's that right blend of in-person and virtual care, right? What's that right blend of in-person and new technologies and tools? And then ultimately, how do you show a more comprehensive return on integration of anything that new?
Right, exactly. You spoke just now about like the red tape that's sort of associated with the implementation, the adoption. We'd love to hear from you a bit more about the friction points surrounding adoption and
Sure.
implementation, especially in the instances where positive outcomes are being experienced?
Yeah. Yeah, great question. Let's take for telehealth, for instance. During the pandemic, actually, more than 50% of physicians use telehealth or virtual care for the first time, right? So just think of that as a learning curve on top of being in really survival mode, taking care of patients during a global pandemic. But luckily, and I think this has been a great stride in the right direction, the enthusiasm for utilizing things like virtual care from both the physician and patient perspective has been quite high. But where there's some friction is at times still trying to overcome hurdles for, is reimbursement going to stay in place as is, right? And if it does not, can I afford to make the investment in a longer term strategy for virtual care? Then also you have a number of new entrants in healthcare that are laser focused on, a consumer experience for patients and patients as consumers, which again, there's a lot of opportunity for partnerships and collaboration there, in my opinion. Another is remote patient monitoring. We've seen from those baseline digital health surveys that we continue to do, which we did again and released a month before COVID, and then another in 2022. So this has been a very interesting trend line to be able to see the adoption and actual usage of these various tools. But remote patient monitoring, while we've seen a lot of growth, right, from this latest survey in 2022, it was still the least utilized of the 7 technology categories that we looked at. So when you think about the massive market potential for remote patient monitoring, especially when you've got really a tsunami of chronic disease and then an aging population and all, that just goes to show you that, again, tremendous opportunity for additional scaling. And when you think of those 4 key questions or requirements that I mentioned, that reimbursement is also now there, but often can get caught up in chief compliance officers not necessarily fully, maybe not understanding what can or cannot be billed for. And AMA is something called a Digital Medicine Payment Advisory Group that was formed about 6 years ago to really look at and address where there's gaps in payment coverage and coding for digital medicine technologies. And as a result of that and evidence being shown for the creation of some new codes, that was really the impetus for those new RPM codes that were there.
Gotcha. Okay, no, that's wonderful. Great to hear all those different points of friction for adoption. Could you delve into a little bit more detail around like what's being done to sort of tackle those specific points? And like you spoke about resources that are out there right now. Is there any specific ones you want to point out?
So the playbooks, as I mentioned, are great tools. And while the target audience for the playbooks are physicians themselves, individual physicians, private practices, large health systems, we've also heard from a lot of founders, oh, we've been using this as a mini Bible of sorts of how we should go to market or what we should be making sure criteria-wise is being thought through as we're going in to attempt to fit a real need for a practice or a large health system, especially those components around how do you integrate most efficiently into an existing workflow? And then how do you show, again, back to that comprehensive ROI. Another resource we put out, this was during the pandemic, was something called a return on health value framework. And we deliberately used the wording of return on health versus ROI because we wanted to help to create more of a balanced scorecard view of you can have a return and show value for things like virtual care, remote patient monitoring, et cetera, beyond just the short-term financial ROI. So think things like health equity, for patient access, for physician and patient satisfaction, and of course for clinical outcomes. And how do you have more of a snapshot view of that on this side, as well as what your own measures of success or environmental variables are. So are you fee for service? Are you in a value-based arrangement? What's your patient population look like? What are your goals? And really, that's been a helpful tool both to, one, develop and really showcase case studies that are happening in terms of best practices across the country that have been really powerful too with our advocacy and policy team to help make the case for more sustainable reimbursement for these tools and solutions. But two, to help make the case internally of here's why, in classic innovator's dilemma, can we afford to do this or invest in this, or can we afford not to do this or invest in this? And again, this helps to show a more bundled, comprehensive view of that.
No, it's great. It's great to be able to let the audience know sort of what's out there that's being used to sort of tackle all these different points and stuff. I want to sort of change the direction of the conversation, talk a bit more about the tech itself, and to talk about where the areas of opportunity are, where technology can play that role to make that difference, and also how you feel like they're going to be utilized in all of these different sort of areas to incorporate diverse and end user feedback as well.
Yeah, I think this is a very large opportunity area, and we've heard flavors of this even in the discussions today. During the intro, it was mentioned that we've got formal and informal collaborations with a lot of different health tech accelerators and incubators across the country. And our main goal there is how do we get as diverse and frequent feedback from physicians as early stage as possible and other members of the care team as early stage as possible in these emerging technologies and all. And we've put out some principles around innovation and equity, and the ethos of those is really around when you're going about designing a new technology solution company, if you're keeping in mind the most marginalized of end user in that regard, your likelihood of success is going to be that much more, right? Because of course you need to keep in mind, often at times it can end up being what we refer to as like a Peloton crowd of folks that have the opportunity and sometimes privilege of being able to have access to a lot of these different solutions versus those that at times can need them the most, and sometimes they're not designed in a way for that to be accessible. I'll even take my dad, who's someone who lives in a very rural area, does not have an internet package at home by choice of some degree, but still, I mean, he's got like this Walmart plan flip phone, which nothing wrong with that. But when we're thinking about apps or solution, he's got high blood pressure. He's at home literally writing down on the back of a receipt his blood pressure readings to his poor doctor and thinking that these are going to be actionable in some way, versus if you were to try to give him an app of some sort, that would take so much sit down, help him walk that through, training for just the tech piece of it, that again, I think is just an example of something that really has to be thought of in terms of who the end users are, both from the physician provider side as well as the patient side. One last thing I'd quickly say is, as part of the accelerator and incubator relationships that we have, we were getting a lot of inquiries, myself and my team, of playing manual matchmaker between companies who said, oh, we'd love to get more physicians involved, or do you know so-and-so in New York who's a urologist with this exact expertise? And we needed a way to scale that. So we built a platform called AMA Physician Innovation Network, which you can think of as more of a match.com to help connect physicians and health tech companies and to help really bridge the gap of getting the right expertise at the right time included in new technologies and tools. And that is also freely available for everyone to use.
Nice, that's wonderful, that's awesome. And I know we are sort of coming to time now, so I just want to sort of wrap up and sort of get some final thoughts on you around the emerging tech that's sort of coming through now. So you got VR and digital therapeutics, and of course AI, which is a massive topic right now. And for you to talk about like sort of the emerging use cases and what the AMA is doing right now to assess the potential, opportunities as well as the risks.
Yeah.
Using it.
Yeah, so back to that benchmark digital health research that we've been doing on a consistent basis. In this last iteration, we did ask about emerging technologies. So again, AI, digital therapeutics, blockchain, other things. One, what physicians were using today. Two, what they were enthusiastic about and what they anticipated to use in the next year or so. And then again, back to key requirements. Those key requirements that I mentioned earlier totally remain the same. Current utilization, about 1 in 10 physicians were using, or to their knowledge were using, any form of AI or digital therapeutics. Their anticipation to use or interest to use, though, those two areas was quite high, with anticipation to use being noted in the next year or two, their anticipation to use these. And this was even prior, and I should state, before ChatGPT has taken over headlines all over the place. AMA, we have put out principles for AI usage, and these are device-based AI principles. We will be working on, and we just had our AMA annual meeting where there was delegates from state and specialty societies all over the country there to discuss, and of course AI was a frequent topic. And a resolution that came from our annual meeting was the development of non-device based, so think ChatGPT and all AI principles of use. So really what I think is going to be helpful, and I've mentioned some of those other playbooks, which we'll be developing one on AI that will be made available this year. So more to come on that. But what we'll be looking to do is really level set on common definitions and more so a taxonomy of sorts for AI, as well as a range of the various spectrum of use cases for AI. So think if you're using AI for administrative purposes of some sort, that's one thing. If you're using it for clinical decision support, that's far another thing. And the risk associated with those two things is vastly different. So that's what we're wanting to help do some level setting on.
Oh, that's really wonderful, Meg. Thanks so much. And thanks so much for your time, Meg.
Yeah, of
for coming
course.
on and